So is it, are you surprised that the General Assembly still is saying, you know what, we're working on a plan, we're going to get to that in January?
As a member of the General Assembly, their level of negligence never ceases to amaze. Like their inability to care, act, or mobilize. And to be clear, you know, it's been 10 months of asking, 10 months of outlining this crisis, and right now we're seeing state, municipal, and local organizations and companies coming to the rescue. We shouldn't have to be right now in the middle of December having this conversation in the first place.
McKee's administration, whenever we've done stories about your encampment, they'll send a press release and say, look, we've already spent tens of millions of dollars since the pandemic began on programs like this. What do you say to that?
They weren't listening then, and they clearly weren't listening to the people in crisis at that time, because it took hundreds of Rhode Islanders to sleep outside on their front lawn for them to start to act. So their excuses didn't work then, and Rhode Islanders didn't buy it, because that's why they had to actually show up and hold them accountable.
The governor this morning suggested that this wasn't the reason he took this action, and it was mostly because of the advocates, the people who were there in the room, like from the Rhode Island Homelessness Association, those people, the direct service providers who had the most impact. How do you feel about that?
Yeah, as Dr. Paul was explaining, the direct service providers and the advocates have been begging and pleading for months, and have really plugged the gaps and been that this administration has left people to fall through, with no response from this administration, no plan from this administration, and it wasn't until the middle of December was that call heeded. And I think we made it clear through every sector, faith organizations and activists and service providers formerly unhoused, across every sector, showing up and saying this is utterly unacceptable and is not representative of the values of Rhode Islanders. And then and only then have they decided to act, which is why we put this here.
Yeah, to follow up on that, the governor used the word presumptive. He said it was presumptive to say that this group had made the difference. What are you saying about what difference this protest made?
It was 9 months that the advocates were begging and pleading and pushing for action and got nothing. Hard to believe it's a coincidence that in the 16 days since hundreds of people started coming out here, they found 400 beds. They finally started taking action. But I have to say that also is infuriating, because if they could do that in 16 days now, they could have done it 10 months ago, or 6 months ago, or 5 months ago. And I'll tell you, here's the thing. They didn't care that there were people outside. They didn't care that the advocates were demanding support. They didn't care about that. The reason they're doing this now, after the 16 days, is because the only thing they care about, they felt was in jeopardy, which is their political power. They felt that Rhode Islanders were coming out in droves, rejecting their policy that some people sleep outside, and they might lose elections in a few months. That's the only reason that they finally got off the dime, and as Dr. Paul said, at least made a start. But the notion that it's a coincidence that nothing for 9 months and 400 beds in the last 16 days since the sleepout began is absurd. Nobody believes that.
I had asked the governor about the $1 billion in ARPA funds that have not been spent, and he said that there's no reason to spend it without a plan for homelessness. You've said there is a plan for homelessness from the advocates. Can you talk about that a little bit?
Yeah, it was given to them months ago. It was given to them a very, very long time ago, and it was comprehensive. It talked about diversion plans. It talked about supportive housing after, which, to be clear, that's why we're saying this is a start. We don't have a moratorium right now, and I will be pushing for that. Rhode Island right now is not a right to shelter state. Think about that. We cannot, the leaders of this state cannot say Rhode Islanders deserve shelter. That is wild to me. We're so much better than that. And so we have a lot of work to do. They've shown us, and we've said this from the very beginning, they've shown us who they are. And now we showed them who we are. And we're not going to let up, because we're never going to let this happen again.
I just add one other thing about this claim from Dan McKee that it was not the people sleeping outside and rallying here that forced them to take action. That is so insulting to the people of this state. People came out here, they were courageous, they dedicated themselves to this. They felt that what they were saying was, we just want our government that represents us and our values. And that's what got the action. It's insulting to dismiss that.
Matt, what do you say to what would be the long-term plan specifically to deal with the root causes of some people being chronically homeless?
Well, I'll say something, but
Yeah,
you wanna go first?
there's so many. First of all, let's start giving people a living wage. We have people that are employed and working full time who live outside. How about healthcare that people can afford, that don't put people bankrupt? Affordable healthcare, we need universal healthcare, things that we've been fighting for a long time that they've shut their ears to, shut their eyes to. They didn't want to hear. And that's a start. There's so many reasons for people that are find themselves unhoused, and all of those reasons start here, because they decided that when you work a full-time job, that may or may not mean that you can actually survive or live and keep a roof over your family's head.
What about the drug addiction and mental health component?
Yeah, they failed those friends too.
I mean, how do you do that? How can
I say something?
Yeah, please.
We'll let the doctor speak to
Yeah,
that.
that's great.
No, I mean, we've seen such a large, tragic rise in the number of opioid overdose deaths this past year. And this problem is preventable,
Yep.
right? So I take care of a lot of patients who struggle with addiction. One of the biggest things that they always ask me is, please don't let me be out in the streets. That's when I start using again. If we can find basic needs, right? Basic needs, housing, food, safety, the stress levels go down, the pain and the trauma that they're going through comes down. Why do you think so many people use drugs, right? I think there's this false narrative out there that people just made some choices and this is what, they're just paying the consequences for it. Why is it that certain groups are being more affected by this than others? It comes back to, are we meeting the basic needs of Rhode Islanders every day? And we're not. We're far from it. So when my patient was able to get into housing, we were able to connect them with social work more regularly in case management. We were able to start talking to them and figuring out, hey, where is this coming from? What's going on? And little bit by little bit, if we're lucky to be able to get past the trauma, we were able to start getting people to stop using drugs, to stop drinking, and to actually become a part of society in a beautiful way. And they are still a part of society. We just try to kind of sideline them. So this whole notion of, what are the root causes of this? It honestly comes back to what Cynthia was saying and Matt was saying earlier, which is that we have to make sure basic human rights are met and then see what happens with people. But a lot of people have gone through a lot of trauma. So when people say, oh, just give them a job and that's how they'll get there. How do you keep a job when you can't even wash up? I have a patient who had to come to our drop-in center because they smelled so bad they had to get new clothes every time. Do you know the harm to their dignity that does? They can't. These are human beings. Imagine yourself in that position. Only when we start meeting these basic criteria, which for some odd reason, it's a radical notion, that we can start to talk about how do we end the opioid epidemic? How do we get people off the streets? How do we get things at the root cause of it? And I really, really think that some very basic fundamental rights, if they were met, we would be seeing a lot less of these problems.
Are there programs in place with this federal money that hasn't been spent that could deal with the counseling, how to get off drugs component of it as well? For example, if you get the housing provided, but then there's no mechanism to prevent that cycle of addiction and such.
So supportive housing has been one of the concepts we've talked about amongst all the people who've been doing this work for so long, right? In order to do supportive housing, one, you need the staff members, you need the numbers to be able to account for the demand, for the need. So one, we need more case managers, or we need the case managers and the social workers and the community health workers to be paid what they are due, which is a living wage. And these are the heroes. So I would say they should be getting way more than that, right? So if we can first start getting people, the frontline workers, the resources they need, we have a lot of models out here that work, right? Where I work up in Woonsocket, I know people who hold circles, who have smaller groups of people who were previously struggling with addiction or abuse in different ways, who have now been 3, 4, 5 years just parts of society without having to use drugs, without having to rely on alcohol to numb the pain. We've done it, right? We just need the backing and the resources. You can't just throw money at this, right? You gotta be smart with it. And in order to be smart with how we use this money, we need to get it into the right hands. We need to actually listen to the right people. And I think that's one of the main things that oftentimes, I don't know if it's just Rhode Island, but everywhere I've worked, it's the biggest problem is someone else will figure this out. No, we have to be working lock and step with each other. The laws that we pass have to reflect what the people on the ground are seeing. And so I think there are a lot of examples on how we could address this, and there's a lot of evidence that supports it. It's just a matter of knowing people, like having people who are competent enough to know who to talk to and how to send out this money.
Senator, you mentioned the right to shelter law. Massachusetts has that, but it's not as simple as passing a law, is it? I mean, what would have to come with that?
It is not as simple as passing a law. We do need to pass the law, which is basically what I first stated, which is that Rhode Island has, the leaders of the state have to be able to say that everyone deserves shelter and deserves to be earning a living wage when they work a full-time job. That everyone deserves healthcare. Healthcare is a human right. There's so many things that Rhode Islanders are saying that the leaders of the state cannot echo back. And there's a huge disconnect there. There's a moral disconnect there. There's a reality disconnect there. And the willingness to act, because to be clear, Rhode Islanders are looking out for each other. They will try to find ways to supplement for the high cost of healthcare, and they will try to keep food on their neighbors' plates and roofs over their friends' children's heads. But the leaders of the state turn the other way, and it has to stop. And that's why this, to be clear, was a moral call to Rhode Islanders about what we know to be true and what could be true, and what the leaders of this state have turned their backs on, which is Rhode Islanders and basic dignity. And Rhode Islanders responded to that call in droves, and that's why I know we won't go back. And we said from the beginning, we weren't here for hope, we were here for action. And we're not going to stop.
What is the plan to get people into shelter? How long is it going to take to get people off the streets at this point?
That's a really great question. And right now, our overworked, underpaid service providers are scrambling to get folks out on the bed. I know there are outreach vans right now across the state in the communities to let people know there are beds available for them. Memorial Hospital, as we were talking, it's I believe it's the first shelter for families. There was nowhere for a family to go. Can you imagine? There was nowhere for a mother to go with her child for shelter. And now we finally have that. We shouldn't have taken people, faith leaders and legislators and caseworkers and physicians, putting their bodies out in the cold for 16 days so that a mother in Rhode Island could have safe shelter with her child. It is absolutely, fundamentally, it's just wild to me that we had to do this, that we had to be here. But, we've also proven that we'll do whatever it takes. And that, they've proven that they won't unless we force them.
Beyond safe shelter, is there any plan to cut people the means of transportation or internet access?
That's a really great question. Some of the supportive care, as we were talking about with the supportive housing, comes with that. In addition to that, for example, internet access, that was part of the ARPA funds we haven't seen acted on as well. There was some allocated specifically for that, and that is the part that is so incredibly frustrating. Is that that the COVID crisis has affected so many people in so many ways, and this money was given to us by the federal government to address this crisis. And to center it around the people most impacted. And so to have the leaders of the state not only sit on that and then turn the other way when we explain to them the laundry list of things that they need to do in order to address those impacted folks, to be able to have the support that they need, is what is so incredibly infuriating, and why this action was 100% necessary.
All right, we're going to do one more question.
What exactly is the next step?
Yeah, so like I said, I'm going to introduce a bill to right to shelter, so for Rhode Island to be a right to shelter state. We're going to push for a moratorium. We are going to continue pushing because we have been for universal health care, for a living wage, for the many other things that we were talking about regarding supportive care and all the rest of the things that need to happen. And this administration admitted hours ago that it scrambled. Literally said the word scrambled. They admitted that they hadn't done enough before. And so to actually admit your incompetence is one thing. To reconcile that, as Dr. Nitin said, is another thing. And that public pressure that they're currently feeling will not go away. Because Rhode Islanders now know that their values not only should